with a proper introduction. I did that. Recording has started. By attending this meeting, you consent.
Hello, I'd like to introduce myself, and I'm Linda Lawless, the Service Manager of Carers in Southampton, and today we've invited Dr M Patel to talk to us about diabetes, about the risks and awareness. So Mayank, if you'd like to introduce yourself, and then we'll talk to Joe and Jagpal.
Thank you, Linda. Hi, everyone. It's really nice to be here. Nice to be asked to talk to you. I'm a consultant in diabetes. I work at University Hospital Southampton. I've worked here for about 15 years, and my main day job is looking after individuals who live with diabetes, I see them in clinic, I see them on the wards, and I also do a lot of teaching for members of staff and for patient groups and for volunteer groups and groups like Linda's. So it's great to be here today. Thank you.
Thank you, Mayank. Good morning, everybody. My name is Joe Chiness. I am the Senior Coordinator working with Carers in Southampton. If you're not registered with us, we are a charitable project who supports unpaid carers looking after someone living in the city of Southampton, providing carers cards, carers assessments and carers events. And today we're really lucky to have Dr M Patel talking about diabetes. Jagpal.
Good morning, everyone. This is Jagpal working for Carers in Southampton. I am care support worker for BAME community. I can speak Hindi, Urdu and Punjabi. You can contact me in your languages to register yourself and come forward as a carer. Thank you.
Lovely.
Okay.
So Mayank, over to you to give us some hints and tips on how to keep ourselves safe.
Thank you. So diabetes, yeah, obviously it's a very common disease. It affects about 5 million people in the UK currently. And we know that approximately about 1 million people in the country live with undiagnosed type 2 diabetes. So obviously today I can't do everything in detail, just present some headlines really, and hopefully some hints and tips for all of you. So I guess from the very beginning, first things, some of you might have diabetes yourselves, you might know somebody who has diabetes, and though it's one disease, it does affect different people very differently. It's remembering that it's important to do your best to live as well as you can if you live with diabetes. And even if you have diet controlled diabetes, if you're on no tablets, if you're on some tablets, there's no such thing as mild diabetes. Having diabetes, whichever type you have, is a serious disease, and doing your best to live well, as I said, is really important. So I guess the first thing to mention is, how do you know if you might have diabetes? I'll focus today on type 2 diabetes. This is the one that traditionally declares itself in later life, but what's worrying is we are seeing type 2 diabetes in children and young adults. This is because developing type 2 diabetes, the risk of that is increased with increasing weight and obesity. And we know that the last few years with COVID, people have been in lockdowns, less physically active, gaining weight, and that's unfortunately resulted in increased risk of developing type 2 diabetes. So if you have there are certain symptoms that suggest you should get checked out for diabetes. So the common ones would be if you start feeling very thirsty unexpectedly, for non-stop feeling thirsty, having to drink lots of water, if you're passing lots of water night and day, if you find you have skin infections or cuts and bruises that take a long time to heal, if you're prone to skin infections or water infections, these are all subtle clues that you might be at the risk of developing diabetes. So it's very important you get these symptoms checked out at your surgery as soon as you can. And there's a very clever blood test that can be done to help confirm or exclude type 2 diabetes. It's not a fasting blood test, it's not a finger prick, it's a proper arm blood test, and the doctor's result comes back fairly quickly and will tell you yes or no if you have type 2 diabetes or not. For when you're told you have type 2 diabetes, it's important to try and obviously it may be a shock to lots of people to develop it. But remember, it's very possible to live very well with type 2 and type 1 diabetes, provided you take a few healthcare messages on board. So when you're given a diagnosis, a common approach is to recommend the importance of understanding that the part that diet and lifestyle measures can play in living well with type 2 diabetes. So there's no such thing as a diabetes diet, but encouraging people to make the healthier food choices in terms of fresh produce, being mindful of portion size, trying to not do too much snacking and grazing across the whole day is really important. And it's not just sweet foods. Of course, sweet foods will raise sugar levels in the blood and contribute to making people feel more unwell with diabetes, because the problem in diabetes, as you know, is a problem of persistent high blood glucose. This high blood glucose is not just due to sugary food, but that is, of course, a part of it. It's also just the fact that the way your body's chemistry is designed, if you have diabetes, it just means you can't use glucose or sugar properly as petrol to give you energy in your body, and therefore the sugar levels will just go very high in the blood, and it means you're just going to feel more tired and washed out and potentially get more unwell. So attention to diet in terms of making those low sugar option choices where you can is important. It's also remembering that high blood glucose over months and years can risk damaging certain blood vessels, the arteries in your body, and certain parts of your body are more at risk. If you have diabetes and the blood vessels get blocked in certain parts of your body, you're more at risk of having a stroke, possibly, having some eye problems, heart problems, kidney problems, and feet problems. So another big part of living well with diabetes is doing what you can to keep your heart and your blood vessels protected and healthy. So in diabetes, lots of people just think it's all about sugar. Lots of it is about sugar, but it's not just about sugar. So it's remembering, apart from paying attention to diet, what can you do to improve the health of your heart and blood vessels? There's a few things lots of us can do. The big no-no is persuading people not to smoke. So stopping smoking is a really important part of living well with diabetes to reduce your risk of future health problems. Paying attention to weight also matters. So where you can make dietary changes, that's fantastic. If you need advice, of course, do talk to your surgery. There's various other diabetes charities who can give you information and leaflets or telephone advice about healthy eating. They have websites. There's resources you can tap into so you know what sort of things you should be trying to eat and drink and help you manage your weight, for example. Something else that's really important part of good blood vessel health is not drinking too much alcohol. So I'm not saying don't drink any at all, but excess alcohol, certain alcohols are very sugary and can cause lots of further weight gain. So we're desperately trying to avoid further weight gain. But if people can keep their weight where it is or lose weight, that's to be encouraged rather than weight gain. That's really important. In terms of other things we can all do, keeping physically active is important for all of us. So I deliberately no longer use the word exercise. When I say exercise, people think gym, they think lycra, they think expensive membership, they think treadmills, running machines. Living well with diabetes is not any of those things at all. It can be, it doesn't have to be. All we ask is encouraging people who live with diabetes to be more physically active. And the activity needs to be something the individual is going to enjoy or feel comfortable doing. So what we're not going to do as a healthcare team is to force people to do certain physical activity type things. So for example, if you enjoy gardening, if you enjoy dancing, if you enjoy going for walks, those are some of the really good things you can do to help keep your weight in check and help your body burn some of the excess sugar in your blood to bring levels down. So that's the sort of activity we're talking about. For those of you with mobile phones, if you can use the step counter, if you can try and do between 7,000 and 10,000 steps a day, that's fantastic. And also thinking about how can you build more physical activity into your daily routine. So for example, can you park your car, at the far end of the car park and walk a bit more? Can you use the stairs and not the lift, for example, at work or and nearby? Can you get off the bus 1 or 2 stops before you normally would do for your shopping or your work and walk a bit more? So ideally, we're trying to encourage people to do 20 to 30 minutes of physical activity about 5 times a week in line with national government guidelines. And the level of activity to try to get to, if you can do it, is where you just get a bit out of breath, a bit red in the face, and you can't quite talk properly. That's a sort of level to gently get to if you can do it comfortably. If, however, you're somebody for whom physical activity is difficult, there's still things you can do sitting in a chair at home, for example. You can do some gentle arm exercises and use food tins as weights. There's simple things around the house you can try and do to increase your activity. Going up and down the stairs in the house, for example, a few times a day is a good thing for your legs. It's a really good workout as well, a simple workout. So those are some of the things to think about in terms of being more active. And also we find that with physical activity, if you can involve your family and your friends, so you all keep active together and enjoy yourselves with sport things, you know, in the back garden, kicking a football or just something like that, playing catch, whatever it might be, just moving, those things can really help you as well. And similarly, with healthy eating, if you can try and do it with your family and friends, so everyone's doing it together, you won't feel so sort of on your own, as it were. You hopefully feel part of the group. You're all trying to live well together and be healthy together, which is a big part of living well with diabetes, for example. Okay, so vascular health, as I mentioned, reducing smoking, attention to weight, physical activity, and less alcohol can all really help. Another thing to mention briefly is about caffeine. So don't forget, tea and coffee does contain caffeine. So as I said earlier, we're trying to promote good heart health. Excess caffeine can be a stimulant for your heart, which obviously can make it beat a bit too fast sometimes, even if you're sitting there doing nothing, which in some people can be quite risky. So if you're somebody, for example, with pre-existing heart disease or heart problems, excess caffeine probably should be avoided, because excess caffeine can do funny things to the electrics of your heart. It can make it beat faster, for example, make you feel quite unwell. Also, don't forget, caffeine drinks like tea and coffee can also make you pass water more often. And if you drink a lot of tea and coffee and pass lots of water, you could get quite dehydrated. And in diabetes, as I said earlier, we're trying to promote good body health anyway, and your heart, your kidneys and your legs, they all need to be supported by good circulation. So making sure you don't drink too much tea and coffee, which can cause dehydration, is important, particularly in this current very hot weather. But also remembering the importance of drinking enough sugar-free liquids across your day. For most people, that would mean 3 or 4 pints of sugar-free liquids across 24 hours is a good amount to drink. You know you're doing well if you pass water, your wee should be a nice light yellow tinge. If your wee is dark, it means you're dehydrated, which puts you at risk of kidney harm and just feeling generally quite rough and tired if you're dehydrated. So anything you can do to avoid being dehydrated is really, really important. Okay, so there are a few of the general measures you can think about doing to try and live better and more healthily with diabetes. So let's take stock. I've told you what diabetes is. I've told you what symptoms you might suggest you have it and getting checked out. Things you can do to live healthily, to help yourself and others around you. Work as a team is important. And then remembering all these things, it's not just a thing that when you're diagnosed with diabetes, you do the diet thing, the exercise thing, physical activity thing first, and you stop doing it. It's just something to try and maintain throughout your whole life as much as possible. Keeping as active as you can for as long as you can is really, really important. In some cases, if your doctor or head of medical team think it's necessary, you might need medication for diabetes, and that's fine. There are tablets you might be offered. And of course, please do consider the need for these without refusing them outright. And recognize that medication for diabetes is very good. It's tried and tested. It helps most people. But if you have questions about medications, do ask, do your own research. I mean, it's important to take an interest in your own health condition. So if you're offered a medication, do ask your doctor or your nurse, pharmacist, what is this tablet? What's this injection? How does it work? Why do I need it? So make sure you take an understanding of why it's being offered to you, because unfortunately, diet alone in diabetes, adjusting diet alone, though it's a really important thing to do, in a number of people, it will not be enough on its own for life to keep diabetes in check. You're likely to need some sort of medication to help you support your first personal efforts around physical activity and make the right dietary choices, for example. And as time goes by with type 2 diabetes, it may happen over months and years or several years, 10, 20 years. Your body tends to become less responsive to certain tablets over time. That's nothing you've done. It's just unfortunate that the body is getting more tired, you're getting older, the pancreas that makes insulin is getting more tired. So a number of medications become less effective as time goes by. And the way your medical team know that is from the symptoms you might describe, as well as the repeat blood test you have every few months, every few years, at least once a year, will demonstrate, is this person's diabetes numbers getting the wrong direction? Are they stable? Example. So, for example, if things are going in the wrong direction or going beyond where they'd like, there may be a need to consider the need for insulin. And obviously, no one wants to go on insulin, of course not. It's never a decision taken lightly to use insulin in type 2 diabetes, but if needs must, please don't just dismiss it out of hand. Think carefully why it's been suggested to you. It's remembering that the pills you're taking are not working properly. So taking the same pills repeatedly when there's evidence they're not working is not going to do a lot of benefit for your health and risk future health risks. So do think long and hard before refusing insulin immediately if it's offered to you. There's a definite need for as to why it's been mentioned, so please do consider that. There are also alternative injections in type 2 diabetes that are not insulin, but over time can help people lose weight and improve their diabetes. So there's something you also might be offered as well in diabetes. So do ask about these questions about these things and look out for them. They're very well used internationally. They're tried and tested across all communities, and they work in all different patient groups, whichever your genetic rate, ethnicity is, etc. They work in everybody. So it's worth keeping an open mind about if certain medications are right for you. Just ask the question. Okay. Something else we're trying to get past in diabetes is about making sure that people don't hold on to outdated messages and beliefs about diabetes. So as I mentioned earlier, there is no such thing as mild diabetes. It's a serious disease for everybody. So when you're told you have diabetes or somebody close to you has diabetes, thank you for all you can do to make the right health choices for you and for them as needed to live healthily. Okay, so I'm not for a minute saying, so again, some people believe with diabetes you can't ever eat anything sugary. That's not true. We all need a little bit of sugar in our diet. The question is about balance and proportion, because I appreciate sugar in the food, as I said earlier, can raise sugar levels, but we need sugar for energy. We all need some. So excess sugar is to be avoided. And I know culturally, at times religious festivals and things, for example, lots of food and sweets and desserts come out and they contain lots of sugar. And that's, that's part of cultural celebration. I understand that. And I'm part of that as well. It's remembering for the sake of a few days, a bit more sugar than usual just for those few days might be okay. But obviously when the festival is over, try and go back to those healthier habits best you can, for example. And I should also have said with festivals and food, though it's sugary food we're concerned about, for heart health, the other high risk food group is fried oily food as well. So deep fried foods, oils, fats, those sorts of things, be careful as well, because those things contain fats, can also contribute to premature blockages of the blood vessels, which can risk heart attacks and strokes in the future, unfortunately. So again, fried fatty foods, sugary foods, all of those things, just consider having those in moderation rather than the norm, if that makes sense. So try and have some good days, have the occasional treat. That's all okay. Just not all the time is what we're trying to encourage in terms of healthy, balanced diet, for example. So yes, with diabetes, you can eat sugary foods in moderation. There's no mild diabetes. It can be genetic as well. So sometimes if your family history of diabetes, your parents, grandparents, brothers, sisters have diabetes, yes, your risk is increased. And that's why it's even more important to live well, because you can do activity in life through diet and lifestyle measures to reduce your risk of developing it. Though you have the genes that might suggest you're at risk, you don't always have, it doesn't always declare itself if you can do things to reduce your personal risk through the healthy lifestyle choices you make, for example. Okay. And other things I'm trying to think. If you have diabetes, people have said to me, I was told I can't drive. That's not true. Of course, you can drive with diabetes. If you have if you're using insulin legally, you have to finger prick your sugars or use a machine to monitor your sugar levels with driving. But if you're on tablets or diet treated diabetes, of course, you can drive. Okay. People tell me, is diabetes contagious? Can I catch it from other people? Sounds crazy, I know, but people say these things to me. You absolutely can't catch diabetes. That's not how it's transmitted. It's not how it's spread. Okay, so if you see someone with diabetes, you're not going to catch it from them. Learn from them, talk to them, try and understand the different things they have to do. And sometimes talking to your family and friends or others individuals living with diabetes can give you personally good ideas of what you could do to make your own personal health choices as well. So all we can do as healthcare professionals is give you a nudge in the right direction around medications and ideas about physical activity. What we can't do is give you a script or a manual on what to do. That's down to you doing some research yourself, getting advice from friends, family, trusted resources on the internet, like I say, diabetes charity pages that are trusted, and working out what might work for you. Because there's no point for myself and my team to talk to you and force you to do certain things that you're not going to do. That's pointless. So trying to find the right things that work for you and are realistic is what's the most important thing to think about. Okay. Other things in diabetes we think about generally are persuading people to make the right choices, as I mentioned. And we know that making changes to your life is not going to happen over one night. We know that it takes time. So sometimes someone might give you some ideas. It will take you a little while to go away, have a think, do your research, and then start to change your behaviors very slowly. And changing just one thing at a time, not too quickly, is important. That's fine. Otherwise, it can be quite a shock to try and change everything at once. So just doing things in bits is okay, and that's fine. Just take stock, do things in bits, no problem. All right. With diabetes, other general health advice I can talk to you about briefly. There's a need to remember promoting good overall bodily health through good hydration. With things like diabetes, as I said, it can risk damaging parts of your body if you're not careful. So for your eyes, in bright weather, wear sunglasses, do go for your eye tests regularly, change your prescription if advised to do that. For example, don't squint and, read in dark rooms if you can't see properly. Don't stress your eyes is what I'm trying to say. Foot care is also really important. So again, avoiding walking around bare feet is really important. So I know I appreciate culturally going to temples and mosques, etc. You'll be required to remove your footwear, and that's fine. But the critical thing is just be mindful where you're stepping. And when you get home, check your feet very carefully. Make sure there's no cuts or injuries. Make sure that your skin is not dry or cracked, because dry and cracked skin can be an entry point for an injury to cause infection, and that'd be a really tricky thing in diabetes. So good foot care is important, but also so is good footwear. So making sure your shoes aren't too tight, make sure your toes aren't pinched or pressed is also a really important part of living well with diabetes, good foot care. And sadly, we see a lot of patients admitted to hospital with nasty foot infections that require surgery, operations, antibiotics, and it can be quite debilitating for some people to have to go through that. So, and I would say probably 80 to 90% of things I see from foot trouble is preventable. Okay. And again, unfortunately, diabetes, after months and years of high sugar levels, that can also cause nerve damage in diabetes. And nerve damage means you can't feel what you're stepping on properly. So if you find your feet feel funny or numb, get it checked out by your doctor. They may ask you to see a podiatrist, for example, a foot specialist, do a more detailed assessment, and they may recommend different footwear. But most of what they'll say to you is about caution around walking around bare feet and maintaining good daily foot care. Your nails, avoiding dry skin, like I said. If anything looks red or swollen or anything's discharging, get it checked out fairly quickly. Don't wait for ages. Get it checked out as early as possible, because the earlier we do things, the less chance of problems later. Okay, so that's where you can help your feet. Kidney health is important, and I should have said earlier, with promoting good blood vessel health for your heart and blood vessels, good kidney health is part of that, because if your kidneys get affected by diabetes, indirectly that can contribute to high blood pressure, unfortunately, and persistent high blood pressure can also stress your heart, which puts your heart at more risk. How can you manage blood pressure? Definitely reducing salt. And I know culturally lots of our ethnic groups, of different backgrounds, enjoy adding lots of salt to food. My plea to all of you is please reduce your salt intake. Salt is a disaster for causing fluid retention and raising blood pressure. If you can find a way to use less salt and use other spices, fantastic. It's just salt in particular is really toxic in excess to your heart and can cause high blood pressure problems, because your heart has to work harder and can cause problems. And high blood pressure also can damage your kidneys as well. So it's really important where you can to make those sensible choices around reducing your salt intake, being active, keeping well hydrated. All those things will really help your heart and kidneys as well, which is important as you get older, living well with diabetes. Okay. There's also a move in diabetes increasingly recognizing the importance of good dental health. It sounds really obvious, but I'm sure most of us listening will be brushing our teeth every day, which is great. For those that don't, with diabetes, please observe good mouth care. because if your blood glucose levels are running high, sugar levels are running high, and it gets around the mouth, that can attract bugs, infections, and cause gum problems, dental problems. And we've seen people lose teeth prematurely well before they should have done because they've got high sugar levels causing gum damage in their mouth. So good mouth care is also a really important part of living well with diabetes. All right. Last couple of bits from me before I ask my colleagues for some thoughts. Increasingly in diabetes, a certain language we're trying to be careful about. So we're trying to stop calling people diabetic. We're tending to prefer to refer to people as people with diabetes, patients with diabetes. I'm a diabetes doctor, not a diabetic doctor, for example. We're trying to avoid using the word fat, replacing that word with weight management, and mention the word obesity on occasion, but the word fat is generally frowned on. Okay, so we're trying to change the language, but support patients with diabetes, people with diabetes in different ways, in ways that are a bit less aggressive and without people feeling judged or scared because they have diabetes. We know that living with diabetes obviously as well can be quite mentally draining, and we know that it's important you obviously talk to people if you're feeling quite burdened and overwhelmed with diabetes. Some of the diabetes charities have phone lines you can call for a conversation. Your doctor can refer you to various other local mental health services for telephone consultations, for example, because talking does help rather than simply bottling things up. Could obviously get you down. We understand that. And if you're a carer, you know, your life is quite busy already. So it's important you do your best to not neglect your own health while caring for somebody else, because that person needs you strong. So the better you can look after yourself physically and mentally, the better you're going to be for that other person as well. So don't feel you're being selfish by not paying attention to your own health needs as well. It does matter. So do go to your appointments, take your medications as advised, you know, seek advice on symptoms you got that you can't explain if you're worried, because like I said, what you don't want to do is store up problems you know, for a long time, because that makes it more tricky to treat some things sometimes if you leave it too long. Okay. So I might just refer back to Linda and Joe and Jagpal at this point, if there's anything I've not covered or any comments or questions I may have raised. Thank you.
I think that was absolutely brilliant. Thank you so much. It's been completely informative. And I know for one that there's a lot of tips there that we can all take and improve our health.
Good.
I will pledge, and I'm sure all of us can pledge to do one of these, and mine will be to stop drinking 12 cups of tea a day and reduce it and drink more water. So I'd like you all that have been watching this to actually think, what one action will you take to improve your health and well-being? Joe, what's yours going to be?
I could listen to him talk all day. Absolutely fascinating. Absolutely fascinating. I had a couple of questions just while you were talking.
Of course.
You covered one of them just around kind of, you know, the mental health impact of diabetes, diabetes, how it can impact people. So you touched on portion sizes and about giving up smoking. Where could we find out about sort of what's an appropriate portion size?
Okay, good portion size. So portion size. Sure. So how can I advise you on that? So I think if I can signpost to a couple of charities we work very closely with. So Diabetes UK have got a fantastic resource and website. So rather than reinvent the wheel, their website's fantastic in terms of very public and patient-centric focused. Lots of great resources there about portion size. They have visual depiction of certain foods, for example. A portion of fruit, for example, Joe, is what fits in your hand. That is a portion of fruit, for example. So with diabetes, anybody, encouraging people to spread their fruit load across the day is better, because eating lots of fruit in one go can raise sugars quite quickly. So space it out for a better way of doing that. And your other question was around, sorry, about
smoking.
Smoking, yeah. So
smoking
cessation, yeah. Smoking cessation absolutely is really being pushed hard. So of course your GP surgery is a good place to start. I appreciate the challenge of seeing GPs. Also pharmacies on the high street are doing wonders in terms of supporting people to get the advice from that point of view. So we've all got a high street pharmacy near us, hopefully, to go and talk to the pharmacists there, who if they can't help, I'm sure they can signpost to somebody who can, for example.
Fantastic. Thank you very much. Jagpal, I think you put a question in the chat.
Oh, yes, I can see it.
Yeah.
So you have no symptoms and you diagnose regular blood tests. So the blood test I'm talking about, Jagpal, is something called HbA1c. Does that ring any bells, Jagpal?
I'm not sure what type of blood test they did.
Okay.
Yeah. So
right. Okay, so I won't ask about your case too much in much detail, but to diagnose type 2 diabetes, there are a couple of things you can do. As you just touched on, not everyone gets symptoms. Some people will have a routine blood test for a health insurance, medical or something like that. They'll have a urine sample. The person dips the urine. Oh, you've got sugar in your urine. That could be the first clue somebody's got diabetes without symptoms. So you don't always have to have symptoms. Sorry, you're right. I shouldn't have said that. So a couple of blood tests you could do. You could have a fasting blood glucose test. That means from midnight, nothing to eat or drink, and at 9 a.m. you go for a blood test, which we know is not very practical for lots of people. It's tricky. It's not as accurate. It's not as practical. And a level above 7 can suggest diabetes. And a better blood test, a more internationally accepted blood test now, is something called HbA1c. In English, HbA1c refers to how much glucose has been in your blood for the previous 3 months. And the accepted number of that range is between 48 and 58. So below 48 is not diabetes. So if it's above 48 and you're found to have that result, that's likely diabetes. Okay. Saying that, if your result comes back as 43 to 47, that result suggests something called pre-diabetes. There's lots of people walking around with pre-diabetes, and that's important to know about, because if you have pre-diabetes, if you're agreeable, your doctor can refer you to the National Diabetes Prevention Programme for type 2 diabetes, and you can be offered information, support and resources on things you can do at home to try and push you back towards no diabetes, away from pre-diabetes, and to stop you going towards diabetes. That's what we're trying to get to. All right, so in terms of diagnosis, the second part of your comment, Jagpal, is about the injection for type 2 diabetes. Yes, so if you meet the right criteria, if somebody is overweight with type 2 diabetes, if they're something called BMI, their measure of their height and their weight, it's a little formula. If the number is above 35, it suggests you're quite overweight. You may benefit from a trial of this injection. There are different companies that make the injection. It can be daily or once a day or once a week. What it does, it works by making people feel more full. And over time, that can translate to reduced food intake. You feel more full, therefore you eat less, and therefore that can contribute to weight loss. Okay, in those who respond. Not everyone does. I'd say 8 out of 10 people respond to this therapy, and we commit somebody to it generally for about 4 to 6 months, and then take stock by repeating the diabetes blood test and seeing if the weight has changed as well. They're the best tells. Has this drug worked for you? So it's something to consider if your doctor mentions it to you, for example. It can also be used alongside insulin as well, simultaneously, because it works differently to insulin. So that's available as an option. And also remembering, what was I going to say, most people who start these injections, that you might, in case you're not told, you might feel nauseous for the first 1 to 2 weeks. Not vomiting, just feel a bit sick. If you can tough it out and get past that, you would potentially, as your body gets more used to it, you should be okay. But as I said, it's not a magic bullet. It still requires people to give attention to all the stuff I've talked about: diet, lifestyle, physical activity, alongside use of medication. It's not the substitute for one or the other. These things work together. So I hope that answers your question, Jagpal.
Yes. Can I take the name of the injection, please?
There are a few different ones. So there are different companies. There's one called Victoza. There's one called Ozempic. That's a couple of examples. There are others out there. All right.
Okay, that's fine.
No problem.
Yeah, thank you.
Brilliant, thank you. Well, I think I could listen, as I say, all day.
Thank you.
To Maya and talk about diabetes. Absolutely fascinating talk. Thank you so much for coming on and speaking.
You're very welcome.
Today. Thank you.
Thank you.
No problem.
And we'd say to all carers, I just reinforce what Dr Patel has said. As a carer, you really need to take good care of yourself in order to
Absolutely.
keep your caring role going. Bit like when you get on an aeroplane, they say put your own seatbelt on before you help somebody else. So put your own health first, otherwise you won't be able to continue with your caring role.
Yeah.
So thank you once
Absolutely.
again, Mike. It's been
Very welcome.
yes. Thank you. Bye-bye.
Take care, everyone. Thank you, everyone. Bye. Have a good day. Bye.
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 Bye.